Welcome to the Startup Support Surgery podcast, where we light the entrepreneurial spark in medics and healthcare professionals. Join me, Dr. Joe Watkins, GP, business coach and co-founder of The How People, on a journey to discover where your medical know-how meets the business world. This will help you find some clarity on how to balance work, passions and family so that you can gain more freedom and control over your life, but also continue to help people, which is actually why most of us went into medicine to start with. Embarking on this entrepreneurial adventure is not easy. It is a roller coaster of emotions, but it's hugely rewarding and exciting in the process. Drawing on my 20 years of blending medicine and business as a GP, I am here to share experiences, insights and lessons. Expect lively chats, expert interviews and real-life stories from medics who have taken their own path. Let's break free from traditional healthcare norms and explore more innovative ways of making a real difference to people's health and well-being, along with paving the way for a brighter future for us as healthcare professionals. Oh, don't miss my free PDF called From Stethoscope to Startup, which is an 11-page guide in the show notes full of practical help and advice. This is your roadmap to kickstarting your journey with us. Enjoy the show. Today on the podcast, I'm talking to Dr. Caroline Gibson. Caroline is co-founder and director of LifeMed Community, which is an online community for all healthcare professionals and health coaches. The aim is to bring the benefits of lifestyle medicine to as many people as possible through a coaching approach, and they have a community of inspired, enthusiastic and confident healthcare professionals and coaches, and it really is fantastic. As you will hear, Caroline and I first connected through The How People when her daughter became part of our membership during COVID, and we've since worked together as I started coaching her several years ago when I first started out. Caroline has got lots to say in this episode. We talk about the issues around medics being obsessively collecting diplomas. We talk about the importance of the lifestyle medicine and coaching as a partnership. We talk about the importance of being brave, the importance of taking opportunities. We talk about the difficulties in marketing yourself and the importance of collaborations and more. Caroline has 3 children and 3 cats and spends a lot of her time in the beautiful countryside of County Durham. Thank you so much for joining us, Caroline.
Thank you for having me, Joe. It's lovely to be here.
Well, it feels like full circle, right? Because we go back quite a long way and I can't really remember how, but I do remember a few years ago, we used to jump on a Zoom call at 6 o'clock in the morning together, didn't we?
We did indeed. I think that was oh goodness, about 5 years or so ago, and definitely know it was before you'd done your coach training, but it was after we'd connected through The How People, which is how I first got to know you. So I found The How People just by word of mouth. I was out for a run with a fellow medic mummy, and I was, as you do, chatting about some of the struggles my kids were having. And so one of my daughters, and so my friend just went, "Have you heard of this thing called The How People? It's amazing." So obviously went and Googled it, found you, then I signed my daughter up for it.
She brought you into our world, which is amazing. So anyway, we connected. We started, I think I was experimenting, wasn't I? And I said, right, I need some doctors to help. And you were quite happy to pop in and help me out. So that's how we met. But tell me what you've been doing since, because you are a very, very busy lady. Like I've introduced you as much as I can, but tell me what you're up to now, and then we can kind of go from there.
Oh dear, I don't know where to start. My calendar is a little bit like Tetris. I have lots of different pieces of the puzzle, which is beautiful because I get to kind of fit everything around family. So back from when we first met, I was still a salaried GP, but in the middle of COVID, I moved sideways to go and set up a post-COVID clinic, which gave me some opportunity to have some clinical work, but then some time to put into practice lifestyle medicine, which is something I've been interested in for years. So I'd had my own journey with lifestyle medicine and really worked on my own health and well-being. But then I wanted to put it into practice But first off, I didn't really know how to use it with my patients. So I did what we often do, and I got a qualification. And so I did my lifestyle medicine diploma back in 2020. So I could say that I'd done the training, that I was confident with the advice that I was giving my patients, that I knew it was evidence-based. But then I still wasn't sure how to use it best. So I also, through that, found coaching, because that's really the key to it. It's not just knowing the facts; it's about being able to support the person that you're working with. And so lifestyle medicine took me into coaching, and that was really the start of it. So I'd done all this learning, and I'd done my lifestyle medicine diploma, and then that led me into coaching, because it's how do you actually apply it and support people through the behaviour change that lifestyle medicine needs. So I learned about coaching, but obviously, because we like to do things properly, I did another diploma in coaching this time. And actually, along the way, I've done 4 different coaching diplomas, which have been brilliant. And it means that I've got a really thorough grounding, and I feel really confident in it. But looking back, that's a lot of qualifications. I spent a lot of time learning. Anyway, so going back to how did I get here, in 2020, I'd been looking for an opportunity to do something a bit different from general practice. I was really frustrated as a GP, as many of us are these days. I was probably on the edge of burnout, but I didn't really realise it at the time. And I just knew I had to do something a bit different. So when this opportunity came up to go and help set up a post-COVID clinic, it was at the right time for me, that it was an opportunity. I was there, and I just went, right, I'm going to try this. And it meant that I could reduce my general practice without leaving altogether. But then, as we all know, COVID just grew and grew and grew. So it became a much bigger thing than any of us were expecting. So in the end, I just left my practice and went into just doing the post-COVID work on its own. But for me, that was a real opportunity, because I had 2 days of clinical work and then time to be able to do something different. So I started offering coaching one-to-one, which was just by word of mouth, really. But I also took the opportunity to apply for some different roles that I would never have applied for before. So I worked for NHS England, supporting health coaches in the NHS, because that was a very new role back then. It still is a new role. We're only a couple of years into that. But so I put my hand up to say, I'll apply for this, and I got it. Didn't think I would, but and it was just a case of just having a go at different things and seeing what happened. So I did some work for NHS England with coaching. I applied for a role with the Practitioner Wellbeing and Support Unit. I'm still doing that. And alongside of it, just had my own independent kind of coaching sort of ticking along, purely by word of mouth. I kind of set up a website, but I'd done that myself, didn't really know what to do with it, definitely didn't market myself. I had this idea that, I'll set up a website and I'll put some things on Instagram and people will just come.
Oh, that sounds familiar.
And clearly they did. A couple of people have found me that way, absolutely. But yes, not as many as I thought. I do have this lovely sort of word of mouth network that people do just come and find me, which is always lovely. But absolutely, I'd had no clue about marketing at all. And then more recently, I've had the opportunity, with doing all these different roles and different projects, to speak at the British Society of Lifestyle Medicine conference and do some other events. And every time I've been to events and people have come up to me and talked to me, they've seen what I'm doing. And the most common question I get asked is, this sounds great, but how do you actually do it? And I've met so many people who've done their lifestyle medicine diploma and then not sure what to do as the next step. So myself and my very good friend and colleague, Adam, who I met through a study group when we were studying for our lifestyle medicine diploma together, we'd both had this same experience that people were doing their lifestyle medicine qualification, but just not sure how to put it into practice, which is exactly how I felt 5-6 years ago. So we decided to set up a community for people like us. So not just doctors. So we support doctors, any healthcare professional. We've got lovely nurses, physiotherapists, dentists, and loads of health coaches who are all really interested in lifestyle medicine, whether they've done a qualification or not. But it's about, how do you actually take that next step? What can you do with it? How can you put it into practice? Our mission is that, we know that the world needs lifestyle medicine. There is such a huge burden of chronic disease out there. Healthcare professionals are burning out. The healthcare system is struggling. And lifestyle medicine can help with so much of that. And we know that there are so many brilliant people out there, the people that I meet, the people that you meet, Joe. All these people have such expertise and can help people, but how do you move from where you are now in the NHS system to doing it differently? So that's what we're doing at the moment.
Incredible. Amazing, amazing, amazing. I love that. And there's just so much there I want to talk to you about. So thank you for giving us, I think hearing that journey from beginning to end is really important, because that is not a straight line. So for anyone that has ever heard, any of these podcasts before, and you're wondering why it's not quite as simple as you thought, I hope you feel reassured every time you hear somebody explain how they got to where they are now. Because it would be very easy to look at Caroline and Adam, look at what they're doing on Instagram, social media, the community that they've built, the things that they're doing, the people they're working with, and think, well, if they can do it, then, that looks pretty easy. I can get out and do that too. But behind that is these whole series of twists and turns and decisions, and, not to mention the qualification bit at the beginning, but there's a lot there. So can I just go back to a couple of things that you said? You talked about this slightly obsessional learning thing, which many of us relate to as medics. And, it's almost like that diplomaritis or whatever. I remember when I first met you, I was like, oh my God, she's got like a million different qualifications. I'd like to talk a little bit about that, because I think what I see repeatedly is that is our comfort zone. Learning is something that we are really good at. And we like that a lot, and we like that, I think, because we're used to it and we're good at doing it, but we also know that gives us that credibility and peace to go out there into the world in confidence. Do you think retrospectively now you needed all of that, or what would you sort of say to somebody that's in that messy middle of diplomaritis?
Oh, I definitely recognise that, and I am fully admitting that I have a very bad case of diplomaitis. Um, I think with all things, there's probably a balance to be had. And I think it depends on why you're doing it, I think is really key. If you're wanting to do something, then there is something about having the right underpinning knowledge that you're safe to practice, that you are working from a solid evidence base. And if you're learning something because you've got a knowledge gap, that's great, because it means that you're going to be a safe, confident, effective professional. But if you're doing a qualification because you need the bit of paper to make you feel like you can do it, that's different. And definitely, it kind of leans into that imposter syndrome, which is probably an overused phrase, but I need to do this to prove that I'm good enough is not a good reason to do things. I'm really lucky that I've had some great coaching and great coaches that I've worked with over the years, and it's definitely moved me from that I'm not good enough, I need another qualification, to I'm doing this next, the next thing that I'm learning about because actually I really want to learn about it and I'm really interested in it. So, because at the same time, we get a lot of pleasure from learning, many of us. We are people who like to learn. We've been to medical school, we've all got like deep interest in these things, and that's great. But doing it because you feel you have to is probably not a good thing. if I look back and ask myself the question, do I need all of them? Possibly not. But at the same time, for me personally, it's brought me to where I am today. So it was right for me, but it doesn't mean that it's right for everyone else.
Yeah, 100%. I absolutely agree with you. And I think it is that sense check, isn't it? Well, am I doing this to avoid making difficult decisions and being brave and getting out there and doing it because I am actually ready? Or do I need the thing first? And actually, you helped me with that because, when I moved, sort of segued from doing the how people into supporting medics with business ideas and how to actually get started with some of the practical business stuff, which was what people were asking me to do because of previous businesses. I didn't feel like I could even begin to sort of help in a coaching capacity. And you helped me work out what was going to be the right thing for me to go and do Tom Dillon's course for 6 months so that I have that experience. I still think what I do is more mentoring and consulting than coaching because it's not pure coaching, because that's a different thing. But those skills that I learned doing that are really important for me in what I'm now doing. So you helped me with that. So thank you for that. So great. We've talked about that a little bit. I'd like to also touch on this whole lifestyle medicine coaching thing, like this combination. And I love the fact that you've highlighted this because I see this all the time and people feel a bit bad about it, but they go to lifestyle medicine diploma, they learn all this stuff and they get completely fascinated about it. And then the application needs this other thing, which is this coaching that I have a lot of medics who maybe are still at a different point in their career and maybe quite happy in their NHS careers and, a lot of my university friends don't really understand what coaching is. And we're all good listeners as medics, aren't we? We like to think that we're good at this stuff without trying, but it's a totally different skill set. That combination piece, how important is that? Like lifestyle medicine and coaching together.
Yeah, I kind of describe it as that coaching is the sort of the toolbox that helps you implement the lifestyle medicine. I mean, lifestyle medicine is such a broad range of things. It includes all the evidence base and the research side of it as well. And so you can use lifestyle medicine in any specialty, any area of medicine. And absolutely, some of the most powerful stuff is that doing that underlying, collecting that evidence base and that research. But for day to day practice, it's about communicating that information to the patients, to the people that you're working with, whether it's your patients in the NHS practice or your coachees if you're a coach, or your clients if you're working in private practice. And just having the information isn't enough. It's about how to really support the people that you're working with. And there are lots of different strategies for behavior change, but for me, coaching is really, really the most powerful one. It's all about having the person who you're working with at the center of their health journey, to approach it in a way that what matters to them, and giving them the power to, and so supporting them to develop the knowledge, the skills, the abilities that they need to improve their own health. And that coaching skill set is that's exactly what that does. But you're right, Joe. We like to think as medics that we're really good listeners and that we're really good at that kind of stuff. But actually, we're so busy in all the traditional medical model that often we're not quite as good as we think we are, and the science does back that up. And the research, there was the NHS survey from last year said that 50% of patients feel that they're not as listened to and not as involved in their care as they would like to be, which means there's a gap there. And for me, coaching really does fill that gap. That moves us from us as medics telling people, or sort of being very directive, doctor as expert, into putting the patient at the center of it.
Yeah, amazing. And we obviously will always link up in the notes some information about that for anyone that's interested in finding out more. The next sort of thing I'd like to come back to is this being brave. So you did the qualifications, you obviously got out there, you put your own website together. We're going to come to the marketing side of things in a minute, but you mentioned you applied for roles that you would not otherwise maybe have done. So you had this opportunity that opened up where you're clinical work altered, COVID related, and it opened up a space in your world which meant that you went out there and you took opportunities and you were brave in what you did. How important is that for somebody that's going out there and trying to do things differently?
Um, so I think being brave is probably one of the most important things, and just having a go and being willing to fail. One of my children's maths teachers describes failing as first attempt in learning. And that, it came from a parents' evening, but actually that was one of the most useful pieces of advice I've ever had, is that actually just having a go, which involves being brave because it's moving us out of our comfort zone. And if you don't be brave enough to move out of your comfort zone, you'll just stay in your comfort zone forever. So hugely important. And not everything comes off. Not everything works. I've applied for things that I haven't got, which is fine. It obviously just wasn't the right thing at that time. And just trying it, seeing what lands. It's like about throwing things against the wall and seeing what sticks.
Yeah. And I have a lot of people that come and to me and they say, well, I only want to do this if it's going to work, or I'm not going to, I can't spend time on this unless I know it's going to become profitable. And I'm like, well, it just doesn't work like that. That's just not how this works. You have to have a different attitude towards this. And it is this sort of lots of tiny experiments that, have a go, see what happens, not quite sure, give it a go anyway, in stark contrast to the way we manage clinical medicine, which is why I think we struggle with it. But there are no guarantees. So we talked about when you were on your own, how difficult it felt sort of going out there and marketing yourself. We've talked about that whole, build a website, post a couple of times on social media and people will come. And that can be it's a very difficult way to get started. It can be a very lonely way to get started. And I certainly I see people reflecting on those early times and really finding that quite difficult and struggling with that a little bit. You're now doing stuff with other people, and I see you on social media all of the time. You're doing great things. You've got good stuff out there. How has that felt doing things as an individual at the beginning and now doing things as a sort of collaborative partnership with other people? Does that feel different for you now going out there into the world?
It really does. It feels really, really different. When it was me on my own, it's quite lonely. It's
Yeah.
very much, firstly, you've just got to do everything yourself, which is, and suddenly things, which is, in some ways, that's been great because I've learned skills that I would never have developed otherwise. I know how to build a website now. I know how to work Canva. I know how to, I know how to plan social media a bit, although obviously not that well. But there's so many elements of setting up that you just don't realize exist. And not all of it I enjoy is the first, you know, I really like the creative aspects of being able to sort of design stuff for social media. Actually, that really unlocked something from childhood that kind of got lost once we started heading towards a medical career, is that you just have to focus on the sensible stuff. There's not enough time for art anymore. But setting up with Adam and Lindsay, our other co-founder, is just such a gift because we can bounce ideas off each other. We can, just sort of sense check things. We absolutely share the load of and lean into our strengths. So, I take the lead with sort of the coaching content and how that works, because that's my area of special interest and what I like to do. And Lindsay is our tech goddess, and just knows how to make it all work, which is such a gift because it means that I don't have to get involved with that. And Adam is our lifestyle medicine expert. He's lead assessor for the BSLM at the moment. So we've all kind of got different pieces of the puzzle that all kind of comes together and complements each other.
Yeah.
but even if you are on your own, you still don't have to do it all individually. Having that community, um, because it can be really isolating doing it really something really differently. You know, even if you're just wanting to use lifestyle medicine in your practice in the NHS, it's quite often the experience that I had when I first started learning about lifestyle medicine and wanting to use it in practice was that the other GPs in the practice kind of went, "What? Do you want to do what?" Um, so even if you're working in a practice, you can still be very isolated when you want to do something a bit different. So that was why we kind of came into the community so you can be surrounded by those like-minded people, because being able to share that experience um, and have strategies for dealing with those road bumps that everyone finds is so powerful. Um, Also, you don't need to reinvent the wheel. Lots of people have been there and done that, and people are happy to share their experience. And, I will happily wax lyrical about the things that I've been through and probably bore people silly, but I like to talk. So,
Well, I think it is that it's the problem shared, it's the struggles, it's the support network of like-minded people, and sharing, ideas sharing. Because I certainly find, I haven't done the diploma in lifestyle medicine, but I've been around enough people in lifestyle medicine to know that this is a whole area that is in. There's an enormous amount of learning, and everyone I know that isn't on this sort of maybe slightly different journey of personal growth and coaching and certainly lifestyle medicine, it's very much that whole, well, isn't it just, eat less, move more, and get more sleep? And I'm like, well, it's not quite as simple as that. There's a lot more to it than that. And I think that's what you're up against when you go into your normal surgery sometimes and try and put this to your colleagues. So having your community, which everybody can access, you do weekly calls, is that right? Do you want to just tell us a little bit about the structure of what actually happens when someone joins your community?
yeah. So, our community, it's open to all healthcare professionals and all health coaches. Um, and So we have an online forum, which all is for all members to access, and that's there all the time. So you can log in anytime. We have weekly live sessions, and we have kind of we have 4 different threads that kind of run through our live sessions. So we do one session a month called LifeMed Knowledge, which is about learning about lifestyle medicine, updates about what's going on in the lifestyle medicine world, and how then you can apply that in practice. That's really excellent for CPD and for those who are doing the core accreditation at the moment as well. Or if you're thinking about doing the core accreditation, you're wanting a feel of what's all this about. Um, we have one session a month on coaching skills. How do you develop your coaching skills? We'll look at a skill, pull it apart, and just really take a deep dive into coaching skills and how you can use them in practice, either as a coach or as a clinician who's wanting to use coaching skills in their practice. One session on practice, so like sort of how do you develop it practically, not from the clinical point of view, but how do you actually put it into practice, and that shared experience of people who've done it before and how you can do it. And the last one is a reflective practice session. So any members of the community can either come in person or send in, I've met this lifestyle medicine problem, issue, case study, all of those kind of things, and just it's space for our members to use as they wish. And we have some lovely reflective practice. So yes, that it's open to any healthcare professional. We've got a lovely MDT approach, and we get lots of different perspectives from different roles, which is lovely. So that's us.
And we're going to link that up in the show notes. And I've got a few different places I want to put a message about this on social media, because I think this is really important. And I know from my program, experience of my program, that community of like-minded people doing similar things and coming across different struggles is really so important. And I think we have a habit of thinking, well, we've got too many friends, too many family, too many children's friends, too many WhatsApp groups. We don't need any more people in our lives. But the the value that that brings you is huge. So thank you for doing that on behalf of everybody that's there and everybody that will be joining. Um, Before we finish, let's just think about, I think we've actually talked about quite a lot of struggles as we've gone along. We've talked about, the idea of marketing, getting out there on your own being difficult, the fact that there are no guarantees, the fact that it can be quite lonely. Are there any other sort of downsides before we go to advice, or combining those two things together if you want to?
Yeah. I just want to go back, actually. There's something that you said there about how we've all got so much on and too many friends and all the other demands on our time, and you think, oh, I don't, why do I need more people? Um we're really are absolutely aware of that, that everyone is just so busy, and I definitely found that, as it's how do I fit anything else in, is a constant thing that's going around in my head. One of the beautiful things about our community is that it is very much, we our primary aim is to make it useful for our members so people can dip in and out as much or as little as they like. It's about using it in a way that works for you. There's absolutely no obligation or commitment to come to any or all of the live sessions. Um, we have a couple of people who attend every single week because they just love it, and that is brilliant, and we love them very much. But also we have people who never come to live sessions and just watch the recordings on demand, because all the back things are in the community, because that's what works for them. And then they can catch up when they're walking the dog or listen in the car. So it's very much about, we're very much aware that everyone's really super busy. So we've purposely designed it with our members in mind, because I know what my life's like and everyone else's is probably just as crazy.
Absolutely, but we've got to fit this stuff in if we want to make it happen. I think we can all hide behind busy. And I think if we want something enough, if you've done the diploma, you've done your coaching, you want to make this happen, you want to fit this into your life, you want to work out how you're going to do it, then you need to shoehorn and find that time. And I talk about time in my free PDF, which is linked in this podcast, because we don't have time as medics, as parents. We don't have those spare hours, but we can find them. And if that involves listening to a recording from your community every time you drive to work or walk the dog, or like you say, waiting outside a kids club, then that's what you need to do. And that's how I started off with the How People. I didn't have any time. I was homeschooling at the time. So I got up and I worked between 6 and 7 in the morning every single day before the house got up. I went to bed earlier, got up, and I created, 5 hours in my diary to be able to work on my business. And I wouldn't be doing anything if I hadn't done that. So we do have to find the time. But I love the fact you've got this opportunity. So what we don't want to do is join communities and pay for programs and courses if we're not going to do the work. We have to do the work in some capacity. Otherwise, it starts making us feel guilty, and we're like, well, why can't we get on with this? We watch other people going ahead of us. We can only control our own responses to this. So don't go out there and buy my program or join Caroline's community because you feel like you should. You do that because it's the next thing that you need to do, and then you set yourself that target to make that commitment. And say you've joined Caroline's community, you've been in it for 6 months and you haven't turned up to a live show. She's not going to roll her eyes at you when you turn up after January. You know, it's okay. We're all grown-ups, right? We get it.
Yeah.
So, if you've made a commitment and it's slipped by the wayside, then, January is a great start. Spring, I think, is a brilliant start for people. We sort of come out of our winter shells in March and we can really take different action. So I'm really glad you touched on that, because I think that's really important. So what would you say to your early entrepreneurial self, Caroline, that was wondering what to do with herself, semi near burnout, not sure, what would be your advice to somebody on this sort of different path now?
Oh, that's a really interesting question, because first, I would never really describe myself as an entrepreneur. That's not how I picture myself at all. Um, I think, looking back, when I've kind of got stuck, it's usually because I've gotten in my own way, and it's usually a whole load of self-doubt, comparing myself to others, um, and I think one of the things that's really helped me get through this is that I've had loads of fab coaching from some brilliant
Yeah.
coaches, and that's really helped me notice what is just my unhelpful thoughts and beliefs, and what's actually real obstacles and action that I can take, and what's in my control. What can I do and say and think that's going to move me forward? So I think my first piece of advice would be that actually just get some coaching. Um, I think the other, I mean, it kind of leads on from that. If I was going to give my younger self some advice, is that into that noticing that I tended to get in my own way. And so a piece of advice would be to notice that actually it isn't about you. The important thing is the value that you bring to your, whether that's with patients or coachees or clients. For me now, it's about the support that I can bring to our members in our community. So our current mission is to create a place where our members can be supported to be confident, enthusiastic, to use their lifestyle medicine and be excellent as we know they can be. So when I get stuck, it's because I don't know how to do something, or I'm anxious about getting it wrong. I'm anxious about saying the wrong thing. I'm anxious about coming on this podcast and looking like a plonker. Um, but so I need to reframe that and remember that the important thing is that I'm doing my very best to support the people that I work with. Um, Having said that, my younger self that I'm supposed to be giving this advice to would probably struggle with that one. So I'd probably just go back to the first piece of advice and say, get some coaching, because then you'll figure that out.
And I think we should all be having a coach at school in those final years, those sixth form years. We need to do coaching through medical school. I think we need parent coaching. Like we all, it's so important. So I'm really, really glad you highlighted that. And each one of those points went back to that. So get some support. And we talked before we press record about the fact that people are jumping into maybe starting businesses or taking on roles after having done a coaching qualification that's unearthed quite a lot of stuff for them. And you talked about anxiety, and you talked about worry, talked about self-doubt. We talk about perfectionism a lot, having to prove ourselves. These are things that we have taken on as roles, and we as medics often struggle with. And I love that, flipping it, that, when you are feeling anxious about doing this podcast, anxious about turning up and doing a call, for example, instead of sitting with that and letting that take over, you're remembering that listening to this podcast is somebody that needs to hear all the stuff that you've said today. And actually, it isn't about you, it's about that person, and the difference that listening to this podcast and hearing what you've done might make to their decisions and ultimately their career path. And it might make, you will never know the impact that has had on any member of your community or anyone listening. So thank you for being so honest about that. And it's always important for people to know that you and I struggle with the same things that they do. So thank you for that honesty. And I think we probably need to wrap up because we've talked about an awful lot. I think there's a lot there for people to go away with. And I really thank you for coming along, and I wish you guys all the best. I'm looking forward to coming along. I'm coming along in January to one of your sessions,
Yes.
so maybe after that.
Yes.
Looking forward to that.
Thank you for having me, Joe. As I said, I was really nervous coming in here, but actually, this has been much, much more fun than I thought it was going to be. So thank you very much for having me.
Awesome. And I look forward to seeing you soon. And we will link everything up in the show notes that you talked about. So we'll see you next time. Bye. I hope this episode has sparked some new ideas or challenged your thinking. Transitioning from medicine to business is not easy. It's about adapting our skills while embracing the unknowns of entrepreneurship. It can be nerve-wracking, but remember, you are not alone on this journey. Please feel free to reach out to me via direct message on LinkedIn or Instagram, or just shoot me an email at joe@bendylegs.com. for support. And don't forget to grab the free PDF from the show notes, From Stethoscope to Startup, which is your go-to guide and resource for diving into entrepreneurship. Many thanks for tuning in. I will see you next time. Thanks for spending your precious time with me.
This has been a Monkey Pants Productions podcast.